Now let's talk about tips for point location. First, we have the elastic tape. A marked elastic tape has proven a very useful tool for simplifying tune measurements and facilitating correct point location. It is especially recommended for measurements on the abdomen, the shape of which can vary considerably from patient to patient. An elastic tape, 1 to 2 centimeters wide and 40 centimeters long, is marked at regular intervals of 2 cm, which can optionally be numbered from 1 to 20. The tape is placed onto the distance to be measured, stretching it according to the correct number of tune for that particular distance. This method allows the use of proportional tune for each individual patient. Examples: for locating points on the upper abdomen, stretch the tape so that 8 units cover the distance between the sternocostal angle and the center of the umbilicus. For locating points on the lower abdomen, stretch the tape so that 5 units cover the distance between the upper border of the pubic symphysis and the center of the umbilicus. Patient positioning and body movements. To locate certain points, it can be very helpful to ask the patient to assume a particular position or to perform a specific movement. Examples: for locating points on the pericardium channel on the forearm, ask the patient to tightly press the thumb and little finger together. This will make the tendons more visible. So here we have a very simple way of locating pericardium 7. So we press the thumb and little finger together for better presentation of the tendons. Okay. Then another one is the tiger mouth grip as location help for lung 7 and LI6. For locating LI4, ask the patient to press his thumb and index finger together. A muscle bulge will form. LI4 is located on its highest point. When turning the wrist joint from a pronated to a half supinated position, the palpating finger will glide into a bony cleft just proximal to the styloid process of the ulna. SI6 is easily located using this technique. As the palpating finger glides along the skin bulge forming in front of it will arrest the finger at the point to be located. This method is very useful for quick location of triple burner 5 or pericardium 6. Then we have the spreading hands technique according to Koenig and Vankura. The spreading hands technique is particularly useful for quickly determining the midpoint of a given distance. For this purpose, the little fingers of each hand are placed on the endpoints of the distance to be measured. Both hands are then evenly spread over the distance. The thumbs are joined in the middle, indicating the midpoint of the distance. Examples: to determine the midpoint of the 16 tune distance between the popliteal crease and the prominence of the lateral malleolus, the little fingers are placed on both endpoints of this distance. So here we have stomach 35 at the level of the popliteal crease or knee joint space. So as you can see, to locate stomach 40, all we have to do is locate the midpoint between stomach 35 and the upper and on the highest prominence of the lateral malleolus. To locate 220, the hands are placed on the lateral aspects of the patient's head with the little fingers touching the apices of the ears. The thumbs are then joined on the vertex of the head and will be pointing to do 20.